Hi, I'm Nurse Elise. We are on a med-surg floor. Are you ready to receive a report on the patient that you will be resuming care for? So Janet Lieberman is a 36-year-old woman in room 1. She was admitted with a GI bleed that has been under control during my shift. You will need to prepare her for discharge. She is allergic to sulfa and her doctor is Dr. McGuire. She has a history of Crohn's disease with intermittent gastritis. 6 months ago, she had an ileostomy, and during her stay, she had a GI bleed under control during an endoscopy. Her latest vitals were taken at 1600 hours. Her blood pressure was 98/60, pulse 68, respirations 18, temperature 98.2, and oxygen was at 98% on room air. Her I&Os are recorded on the chart. She had a CBC sent at 0600. Her red blood cells were 3 million, hemoglobin 12, hematocrit 37%, MCV 105, MCH 45, white blood cells at 6,000, and platelets were 162,000. A coagulation study found all of her normal values, so PTT was 21 seconds, PT was 12.2 seconds, and IRN was 0.07. Her blood type is A negative, and her cross matches are listed in the chart if she needs another unit before discharge. And a fecal oral blood test was positive for blood in stools. She has been given normal saline, morphine, acetaminophen, infliximab, and go lightly while during her stay here. She has orders for PRN, morphine, and acetaminophen. She had a unit of red blood cells administered, and the second bag was stopped halfway through because she experienced an acute transfusion reaction. So we just stopped the transfusion and got her vitals under control. So I did a focused assessment on her GI. She had hyperactive bowel sounds and abdominal tenderness, probably related to the endoscopy. She has no apparent masses, so her stomach is soft and flat. Skin is smooth. There is tympany to percussion in all 4 quadrants. There's no masses on her liver or spleen. She doesn't have any rebound tenderness, but she does have overall abdominal tenderness. And her ileostomy is on the lower right-hand side of her abdomen, and her normal drainage is semi-liquid stools, and she's experiencing red streaks due to the GI bleed. Her head is normal cephalic, mouth, throat are pink, dry mucosa with no lesions, uvula rises with phonation. Her heart rate is elevated, but S1 and S2 sounds are normal. There's no S3 or S4 sounds. Breath sounds are clear and there's no adventitious respirations or respiratory sounds. Musculoskeletal and neurologic exams are intact, and she is alert and oriented ×4. My recommendations. So she stated to me that she usually uses wine to relax after work, and based on what she told me, I'm kind of concerned about her alcohol misuse. So I think it would be important to perform a CAGE test and have a discussion about alcohol use and what that means since she has Crohn's disease. I would also want you to include the complications she's at risk for and figure out a plan for her to cut down on her drinking. Some stress reduction techniques that we talked about that should be enforced before discharge are regular light exercise, journaling, listening to music, considering a pet, getting adequate sleep, promoting relaxation. I recommended aromatherapy, yoga, and breathing techniques for those. I think it would be important for her to consider a social support group. She did just have an ileostomy placed, and that is a really stressful, life-changing event, and I want to make sure that she has networks to support her through that. And she does have orders for a dietary consult before discharge. Since being admitted, she's been on a soft, bland diet. So after her acute exacerbation, it's important that she's going to get enough protein when she's at home. So I think it would be interesting to see if she would consider replacing her morning latte with a protein shake, because she should not be having any caffeine due to her Crohn's disease. And maybe even figuring out if she would replace her glass of wine with a protein shake as well. Do you have any questions for me?